Thanks for listening today. I want to be transparent with you. Besides hosting this podcast, I also work for Everly Health, our sponsor for today's episode. However, all views and opinions expressed on the podcast are my own or those of my guests, not those of Everly Health. Welcome back to Digital MD, the podcast where we talk to leaders in the healthcare ecosystem about innovation, design, decision-making, and how they think. I'm your host, Dr. Liz Kuo, and today I'm thrilled to have Rob Andrews with us. So Rob currently serves as the CEO of Health Transformation Alliance, short for HTA. As a CEO, he oversees a strategic direction of over 60 major corporations that have come together in an alliance to do one thing, which is to fix our broken healthcare system. He's responsible for more than 8 million employees, their dependents, and retirees with an annual healthcare spend of over $30 billion. So before we dive in, I was just thinking back about when we first met at Health Evolution and how Rob just has this great perspective on innovators and thinking through how to support them. So I just wanted to welcome you onto the show.
It is really great to be here, and I'm flattered that so many great innovators are listening in to us.
Thank you. So before we dive in, I just want you to tell us a little bit about yourself, how you've seen your career and where you're seeing healthcare go these days.
My story, like a lot of people's story, has a personal aspect and a professional aspect and a futuristic aspect. That personally, I remember I think about the importance of the relationship between providers and patients. That I came along really late in my parents' life. My dad was 48 when I was born. My mother was 39. They had no other
Wow.
children, and I think I was a big surprise. And they were like young most young parents would be. They were still very nervous about how to take care of me. And I remember that we had a wonderful pediatrician named Dr. Ronald Bernardin in New
Hmm.
Jersey. And I don't know why I remember this, but he would let my parents bring me in through the back door of the practice, so we never had to wait in the waiting room. And I think he did it. He's long since passed, but I
Hmm.
think he did it because he knew that my parents had special worries and needed maybe a little bit of tender loving care. And I just remember if Dr. Bernardin had said that my parents should throw me off the top of a tall building, they would do it. I mean, they had
That's,
complete trust in him. And I think that it came from the fact that he listened to them. He was
mm-hmm.
empathetic. And I think most of us, there are so many negative stories in healthcare where people tell horror stories. I tend to reflect upon the good ones where we've had doctors in my family that have done wonderful things for us. And
Yes,
I would like that same kind of wonderful trust and empathy to once again be the rule and not the exception.
I like
I
that.
don't fault providers for that, Liz, that it's, if you're told you need to see 10 patients in 60 minutes, that's what you do. But
That's true.
the system doesn't allow for it. So that's the sort of personal side. The professional side is I practiced law for a while. I served in the United States Congress for 25 years, and I
Amazing.
was deeply involved in helping to write and implement the Affordable Care Act in 2010. And then my evolution has taken me to HTA, where we're trying to use that purchasing power that you made reference to of employers to achieve better outcomes. And that's such a cliche. I sort of wince when I say it, but so many other aspects of the US economy, you get paid on the basis of how well you do your job. What kind of outcomes do you produce? If you're a home builder,
Mm-hmm.
produce wonderful, safe, affordable homes that people want to live in, you succeed. If you don't get paid by how many houses you build, you get paid on the basis of whether people want to buy the house or not. And
That's
I think
right.
that's what we have to make healthcare into, is a system where great results are rewarded with great opportunities, and not just a system where the frequency of the procedure drives the economic opportunity.
I feel like to that point, you tied in this idea of feeling like you're heard, you're listened to. People, especially in healthcare, they're not going to do anything unless if they trust you. They trust oftentimes Dr. Google, but there's also things that they trust around, let's say, a provider that tells them what to do. How do you tie the provider relationship and the things that you're seeing with the employer benefit strategy that you're thinking about?
Yeah.
Especially, going back to your just quick point on people don't remember what you've said, what you've done. They remember how you made them feel. And I think a lot of patients that I see really feel that way. Like they really care about if they trust and know how you make them feel secure and you can follow their guidelines, especially in
I,
employer benefits too.
I think there's a good news and bad news part of the answer to your question. The good news is I think the vast majority of providers absolutely have the capability for empathy and respect for patients and the kind of bedside manner that we see. I think that's very good news. You rarely meet someone who's indifferent or arrogant. Rarely. You really do. The bad news is that they're embedded in a system that, at best, doesn't encourage them to be empathetic,
Mm.
and at worst, punishes them if they're empathetic. So, the strategy, the approach that employers try to use is how can we alter the payment system so that instead of how many patients the primary care doctor sees in an hour, it becomes how healthy are those patients that she sees? And
So
that would shift the model, hopefully, to one where the physician who takes time and gets to know the patient is rewarded economically for that and not penalized.
are you doing that right now in the way that you're, as we talked about the alliance, focused on supporting, again, employers to generate that type of time and ability for providers to do that, but at the same time also looking at the ROI? So
We
what,
are. We are indeed. We have a primary care solution that works with primary care providers around the country on a capitated basis, where in effect it's concierge primary care for everyone, not just for high income people can afford it.
Hmm.
The idea is that an employer pays an annual budget to a primary care practice, and the primary care practice gets that budget and works within it. Now, this doesn't apply to the total cost of care for the patient because that would be unfair to the primary care provider, right?
Yes,
If you can control if you can't control what happens at a specialist office, but you're held accountable for that result, that's not fair. So what we
that's right.
try to do is that make it so the capitated payment extends to the interaction the PCP does with her patient or his patient. And it's very new. We're in the first couple of months of this effort. But the ability to say to a patient that if you want to be seen virtually, you can be seen 24/7 at your convenience.
Hmm.
If you want to be seen in person, you'll get seen in 36 hours or so. That you have an opportunity to develop a relationship with one or several physicians at that practice, so you don't feel like you're sort of a commodity being passed around from provider to provider. And then, frankly, if this works properly, that primary care physicians are paid better and have a
Yes.
better quality of life, that they would have the opportunity to have more time with their children, their hobbies, their development. They'd be paid for it and they would be rewarded for developing the kind of empathetic, respectful relationship that we seek, not chastised for it. It's a
We're
big challenge, but it's one that we think we're up to.
We're seeing that a lot. I think even in the telehealth space, being able to not just do one-off checkups, but being able to send an annual wellness kit. Everly Health now does this. We send annual wellness checks ahead of time, do the cholesterol, diabetes, kidney tests, and other things. And then that way you can create already metrics ahead of time for a PCP to follow up. A lot of, like you said, the focus is how do we catch people at the time that they need it, what they need, with the provider that they trust, and being able to do that with episodic chronic care or management is key. And like you said, with the certain type of schedule that you're talking about, um, I think capitated risk, like you said, it's an interesting model to try to focus on.
We're placing a bet on capitated risk that enough people will say, I'm willing to limit my choice of going to any primary care provider that is in my network, which people like. But I'm
Hmm.
willing to sacrifice that, to give that up, to have a real relationship with a person I trust,
Hmm.
where I can see them more quickly than I otherwise would. And I'm going to get a better experience. And I don't think it's even a majority of patients that will make that choice right now. But if it's 15 or 20%, even 10,
Yes.
it
Yes.
begins to turn the ship around. So our objective is, we have 5 million members, 5 million lives get their health coverage through our employers.
Mm-hmm.
If we could get to 500,000 people in such a system, first of all, it's significant revenue
Yes.
for the providers, and that matters. People do what they get paid to do. And we do think it begins to move the needle. So that's one very pragmatic way that we are trying to re-evolve, if that's a word, or
Yes.
evolve back to a time when my parents talked me to see Dr. Bernard, not to an urgent care center.
You
But
mentioned,
he had time to understand that, this was a 50-year-old man and a 40-year-old woman who felt a little overwhelmed about raising a baby.
hmm,
Who understood that they placed some value in being able to see him maybe more often than his budget would have allowed. And by the way, this was at a time, if I remember correctly, that my dad's health insurance didn't pay for the doctor visit. My parents did out of pocket. Yeah,
yes.
I'm a child of I was born in 1957. And I think I'm right that when I was seeing Dr. Bernard in 1961 or 62, I don't
Hmm.
think Blue Cross paid his fee. I think my parents did. And
Oh, I have so
the
many.
situation has evolved.
These situations, I think, have continued. I even at times have been able to change my own provider. I was actually seeing someone after I unfortunately had a stillbirth. I think you and I have talked about. I lost a baby at 9 months and then needed to find a specialty care doctor. The first one was not empathetic, didn't really understand what I was going through. The second one, I so happened to be doing a procedure and she was just listened and she actually tried to understand the pain. And being a provider and now on the other side as a patient, you just realize how important that trust is. So I switched providers and I've recommended 20 people to this new amazing IVF doctor, infertility and slash IVF doctor ever since. And she's been amazing. So
And
having that trust.
we want, as I said, the good news part of the question you asked me before. She's amazing, but I don't think she's atypical. I
Hmm.
think that many, many physicians, in this case in the fertility field, are wholly sympathetic to the concerns and worries of their patients, but they're laboring under an economic and regulatory model that doesn't give enough
Yes.
time to do that. And if I had one wish that would guide the system overall right now, it would be that the resources are freed up to pay physicians, specialists, and PCPs
Hmm.
to spend whatever time they think is appropriate to get to know their patient. Reward them for it. Don't punish them for it. The closest we can come to
Yes.
that is a capitated plan with primary care, and we're trying to, spread that gospel as quickly and as far as we can.
That's wonderful. Are there other areas that you're innovating in, whether it's data or mental health or other um, disparities that you're addressing? I'd love to also touch on that.
Certainly, data. There are now more than 4 million people whose claims and demographic data are in our data aggregate going back 5 years.
Hmm.
This is de-identified data. It's not personal health information. Well, it is PHI, but it's de-identified.
Hmm.
And it does give us the ability to, on behalf of our members, say, well, here's either a problem or an opportunity that you have.
Yes.
So we look at you as an employer next to your peers. We see that you have fewer vaccinations,
Hmm.
and
Hmm.
that the infrequency of vaccinations seems to occur most likely upon rural women. I'm just making this up, but rural women. And so let's work with your carrier or
Hmm.
your provider systems or others that might be willing to play your PBM to play in this space. And let's figure out a way to communicate to more rural women about the benefits of vaccination and try to close this gap.
I really love that.
Well, that's sort of information available anywhere. Yeah, it is. I mean, no disrespect to other players in the supply chain, but typically that data is held by people with a vested interest or a product they're trying to sell.
Yes.
And there's nothing wrong with that. If Pfizer has information about who isn't getting vaccinated and wants to change that, that's a good thing on balance. But what we're trying to do is say, look, we're not trying to sell you vaccinations. We're not trying to sell a point solution or a product here. what we're trying to do for our members is identify the problems and opportunities they have through the data,
Hmm.
and then help guide them through the choices they can make to get a better outcome.
I love it because you're doing predictive and you're prescriptive. Not only are you
You
just
bet.
analyzing it, but you're now saying this is the next step. And then you're comparing because you're saying across the population of these types of healthy or not as healthy individuals, this is what we're seeing. You're not performing as well. And these are very objective data points. So,
Hopefully, in being predictive and prescriptive, we're also not being pedantic. And
yes.
I see a tendency in healthcare data where people will say, oh, this is an easy problem to solve. Not enough
Hmm.
people are getting vaccinated, so go out and get more people vaccinated. What they
Mm.
don't understand is that if you're running a health plan with 20, 25, 30, 40,000 or more lives in it, you've got a lot of other things you're doing that day.
Yes, the
And
responsibilities.
making sure that the card gets honored and the bill gets paid and that the calls get returned, that doesn't just happen. A lot of people have to do a really good job to make all that happen. So what we try to do is not be a lecturer at employers and say, oh, how
Mm.
could you possibly live with this low rate of vaccination for
Mm.
measles or whatever? What we try to do is say, well, we got it, that you've got 3.5 people taking care of 30,000 people.
So
And we'll look for a way to leverage other assets you have to get that done.
I like it because it's preventative, it's prescriptive, it's also proactive and telling people. And like you said, it's not pedantic, but it's going to focus on what are better outcomes. Did you know that improving preventive care can significantly impact your health plan star ratings? Everly Health Solutions is the leader in at home testing for health plans. Their convenient, member centric approach has helped plans achieve industry leading results. In just 1 year, Everly Health Solutions helped a multi state Medicare group improve 15 of their plans by at least 1 star. That's a win for members, providers, and the plans themselves. Learn how Everly Health Solutions can elevate your health plan at everlyhealthsolutions.com. I touched on this earlier. You said sometimes there are point solutions, and you try to aggregate all those so that there's one way to look at it. How would you help, let's say a digital health provider think about the employer space when they want to work with you at HDA? How do they think about the way that you think when you're deciding between all the solutions and benefits that you want to deploy?
There's three things that point solution provider should always keep in mind. The first is, can I demonstrate that my value proposition is real and works? Now that's frustrating because everybody can forecast that it will work and maybe they can show in small samples that it does, but employers never want to be the first kid in the swimming pool.
Hmm.
That they want to know that someone else has jumped in and the water's fine. And so that's really hard. Finding the first couple of customers and then being able to elucidate and produce data that show that your value proposition works is hard.
Mm-hmm.
If you can do that, the second thing you got to remember is that employers will look at you and say, are you adding to my friction or reducing my friction? So if let's say that you have a vaccination education point solution, and if the employer is required to use that solution to sign a separate contract with your solution, separate from their carrier and their PBM, they're required to do data sharing with the vaccine producer or vaccination solution. And if they're required to sort of manage a whole new vendor relationship, they will rarely do this. Because again, it's 3.5 people taking care of 30,000 people in a course of a given day. If you become a friction reducer, if there's a way that the PBM will pay for the vaccination, or the carrier will pay for the vaccination, or the data sharing is sort of already accomplished, something we try to accomplish for our members, then you're a friction reducer because you can increase the number of people who are vaccinated without increasing the amount of work for that benefits team that has to do this. And the third thing you always got to remember is that it's exceedingly important that the end consumer, the person getting the vaccination, has a positive experience, but they're not the customer. Among self-insured employers, the benefit leads are the customer. So if you're pitching your vaccination solution idea and you tell the benefit lead, first of all, getting to see her is hard because she's really busy. She's one of those 3.5 people that are taking care of 30,000 lives.
That's right.
If you get to see her and you constantly tell her in your pitch, here's something else not to do. Everyone has heard that at least 30% of the money in the US healthcare system is wasted. They don't need to hear it again.
Yep.
Everyone has heard that the system is unduly complicated and expensive and consumers don't really like it very often. They know that. Don't spend the first 15 minutes telling them something they know.
I agree with that. I've heard so many pitches that focus on that.
Here's how we will solve the problem. When solve the problem, if the talk track on that is here's why the consumers will love it so much, it's necessary, but it's the second point you should make, not the first. The first point that you need to make is here's what you have to do, benefit lead. This is what you have to do to make this work. And hopefully the answer is it's pretty easy.
Yeah.
We tried to reduce friction for you. So if you hit the big three here, which would be, I've got a solution to the problem and I've got data that it works. We have the solution aligned in such a way that it can reduce friction for you, not increase it. And it will be a great experience for your consumers because it will reduce cost and improve health. That's the formula. Now, it's a little counterintuitive.
I love it.
Yeah, I'm sorry.
Well, I was going to also ask another thing, which is your third point. How do you help the benefits manager understand that this will be minimal work and they won't be taking a risk? And that, because some of the other things I've learned over the years of selling to employers and payers is that you need a champion and you need someone who is willing to risk a bit of their career to take a leap of faith on you. But on top of that, they may not be in the organization for indefinitely. So if they're going to leave in 6 months,
I'm not pitching job opportunities for any particular group of people, but my answer is pretty simple. Hire some people who've actually done that work. We're really blessed in our organization. We have 5 women who at different times of their careers have run benefit programs for major companies. McDonald's, Pitney Bowes, Corning Glass. They're all women, not by coincidence, because a majority of the leaders in this space are women. Not all of them, but a lot are women. So I have 5 colleagues, 5 women who, if someone came to me with a vaccination solution, the first place I go is to them. And I would say to them, what do you think of this? And the way I frame the question is, if you were back at your old job and you were asked whether or not you'd recommend this solution for your health plan to your CHRO or whoever makes the choice, option 1, we'd buy it. Option 2, I'd want to know these things before I could make a decision. Or option 3, I wouldn't be interested in. And this is incredibly valuable insight. So to answer your question is, we ask people who sat in that chair. So I might think something's really easy, but I don't know what I'm talking about. I've never sat in that chair. I'd much rather go to someone who has and say, what do you think about this? And what we get out of it is very, very, very valuable advice about the things that do and do not work.
I've also learned over time is to show the ROI and or the benefit early on. So if you're doing a pilot, you can do a ton of pilots, but no one will scale if they don't see that after the pilot, within 6 months, within 3 months, you're seeing some good results. Another thing is,
a very good friend of mine used to say, you should always underpromise and overperform. A great credibility shatterer is to go into a benefit lead and say, you're going to get 10-to-1 ROI on this and save 15% of your healthcare spend. They've heard that a lot. A much better way to say is, look, we think at a minimum, this gets you 2 to 3 ROI. Here's why. We tried this with 5,000 patients in a pilot. This is what we found. This is what we could do better. This is what we learned. Don't think that admitting that you learned from things you didn't do well earlier on is a weakness. It's a strength.
That's great.
Because it shows that you are an Aristotelian, Aristotle's method, really the father of the scientific method. Try it, learn from your failures, fix it, try it again, learn from your shortcomings, fix it. And anyone who goes in and says, no, we've got this all figured out. Here's a way that you can get 10 times as many people vaccinated, and it's going to save you 10x of your investment, and it's going to be really easy for you. There's no hard stuff. There'll be no unexpected things that flare up.
Mm-hmm.
Shattered your credibility because nothing works like that. Tell the truth.
I really like this. And as we start to think about closing with the podcast itself, I wanted to understand if there's anything that you feel like are good for entrepreneurs to understand, not only with the selling, but also, I love this idea also you mentioned of creating credibility, following through. Are there things that you think people also miss the mark on that you see often?
I said it earlier, I'll repeat it. Redundant recitation of the problem is a brain numbing.
That's good to
Look,
know.
not enough Americans are vaccinated. It's really bad when they're not, because they get sicker than they should and they cost more money.
And that's like 15-minute pitch in. Mm-hmm.
Sun rises in east. I mean that you're talking to people that understand that. It's so much more effective to go to. We all know that underwhelming rates of vaccination, people get sicker and cost a lot more. Here's what we think you can do about it.
Great.
Or better yet, here's what we've done about it in this pilot. And then the other thing I think that's, again, really important before you are in the meeting is listen to people, women and men, who've been in that chair as the buyer.
Mm-hmm.
Hire them.
Mm-hmm.
Listen to them. Go to them and say, have a dress rehearsal. The great trial lawyers, I sure wasn't one, but great trial lawyers do a mock trial before they take the trial actually to a jury. And they hire people to be jurors, and they find out I'm certain former President Trump did that for his trial here in New York. I'm certain, because you want to find out what works with a jury and what doesn't. And in effect, you want to have a jury of your peers here, which would be benefit leads.
Yes.
And ask them how they feel about this and learn that doesn't mean, by the way, if they say, oh, I don't really like this product, that you quit. No. What you think about is how can you take the perceived weaknesses of the product and turn them into strengths? How can you do that?
So one last career question, and then we'll jump into the hot takes, is how did you experience your experiences in the House of Representatives and then also in private law prepare you for your role as a CEO of HTA right today?
Prepared me for my role by learning that if you don't do two things before you make a decision, you almost always get it wrong. The first is listen to a fair number of people, what they would do. Doesn't mean take a vote, put your finger in the wind and see what people think, but listen. How do people feel about something before you make the decision? And to people who are relevant to the decision, who are stakeholders in the decision. The second thing that I learned is the biggest mistake you can ever make is to say, I've never made a mistake. Now, I don't want to listen to somebody who makes mistakes all the time. But if any decision maker says, well, I know that voting for this tax bill is a great idea because I've always been right about tax bills. No. I think that you're far better off if you say, I misunderstood an issue 5 or 6 years ago. I tried to learn more about it, listen to people. And the reason I've changed my mind, or the reason I would do differently here, is because of this. That I think people rarely expect you to be, never expect you to be perfect. They rarely expect you to be right almost all the time. But they value someone who is introspective enough to say, I'm willing to admit I might be wrong. So I try to think things through really carefully before I make a decision. They'll give you the doubt if they believe that you're motivated by the right values and that you use a process that's inclusive and thoughtful. they know you're not always going to get it right, but they'll trust you to use the best judgment you can. No one's perfect.
Great advice. I really appreciate that. As we close, I usually ask for the 5 hot takes of these questions. And so the first one usually is best advice you want to give. Do you want to revisit that, or do you feel like you've already shared everything? Because the next one is the favorite business quote.
Yeah, the favorite business quote I actually heard really recently. Warren Buffett, in his annual Woodstock for Capitalists, said you should try to get a job that you'd hold even if you didn't need the money.
Mm.
Love that
Hmm.
advice. Now he has a job. He doesn't need the money apparently, but he has a job in advising people about investments that he loves to do. And I feel blessed every day that I get up and have a chance to do a job that I would do if I won the billionaire lottery. I'd still do this job because I love it so much. So try
Yes,
to find a career or a job that you would do even if you didn't have to get paid for it.
that's right. And then because of that, you'll feel like you never have to work a day in your life.
That's
And
a
I,
corollary to that principle. Yep.
yes. How about the hardest challenge and how would you overcome it? Or how did you in the past?
Yeah. Well, still overcoming. I think it's a present tense. Um, my hardest challenge is knowing when to end the process and make a decision. I have made both mistakes where I will make a decision too rapidly and miss something and maybe get it wrong. I've also made the mistake of taking too long in a process to make a decision, and therefore a decision passes us by.
Hmm.
So it's a Goldilocks problem, right? Not too hot, not too cold, just right. And I think every day you have to ask yourself as a decision maker, did I think about this too much? Not enough? Did I listen to enough people? To more people than I should?
Hmm.
And learn the difference as to when the right time is to what they sometimes call in politics, call the question, make a decision. And I would use the present tense verb. I'm still trying to overcome that challenge. I don't think you ever reach a point in your life where you say, I always get that right.
Hmm.
But I think that's the most important thing. I value process very highly. I've said a couple times that listening to stakeholders, really hearing them, being respectful is awfully important.
Yes,
Well, if the process overwhelms the decision and the house is on fire and you listen to every fire department as to what to do, the house just burned down.
absolutely.
You gotta plug the hose in and squirt it at the fire. So
Yeah, I oftentimes think if an indecision is making a decision. Basically, you've wasted
it
time
is.
and you're not able to move ahead because of it. So, um,
Paralysis is a decision.
yes. What's the most exciting thing for you in health tech right now and innovation?
The most exciting thing for me is the ability of generative AI to solve massive puzzles much more
Hmm.
quickly and accurately.
I
Um,
would.
and I think this applies to everything. That
Yes.
I was reading this weekend that there's, you're a physician, so you know this, but the liver is the one main organism of the internal organ, at least of the U.S. of a human body that can regenerate itself to an extent. The
Hmm.
liver can do that. And there's all this research being done on medicines that would restore the liver's regenerative capability. And thus far, the fact is early in the process of liver disease, there's some medicines that are really pretty effective at this.
Right.
But when you get past like mile marker 2, it doesn't work anymore. That's a puzzle that researchers have been working on for decades and decades. Like the first research I think I saw on this was in 1956 or something.
Hmm.
Um, the ability of data to be gathered and analyzed in nanoseconds that used to take decades means it's very likely to me someone's going to figure out the secret sauce and push that regeneration possibility much later in the disease state.
Yes, it's
And
true.
that probably means that very few people, many fewer people will suffer from cirrhosis or suffer from other diseases and die because of it. So I believe that if you take the amazing progress we've had in healthcare in my lifetime,
Hmm.
the late 1950s, and you strap that human intelligence and ambition and empathy to the ability of generative AI to solve problems much more quickly and sort much more quickly, I truly believe we're on the verge of a explosion in life expectancy. I'll put it to you this way: your children are little girls, right? Or
Yeah, I have
they're
three of them, boy, girl, girl,
yeah,
all under 10.
yeah. I would not be surprised if your children live to be 200 years old.
I sure hope so. But I do think that's true in terms of longevity. We are seeing everything from, we talked about data. We talked about the ability to generate medicine much faster. LP little a is another biomarker that's diagnostic right now for heart conditions. And it's going to change. And there's now medication coming out for it in phase 3 trials. We're seeing a ton more work that's going to be much more integrated into our everyday
And
lives.
the reason I share your optimism, it's an analogy. I usually don't argue by analogies, but I will here. My dad was born in 1910, very shortly after the Wright brothers had flown an airplane clumsily for the first time. By the time he was 59 years old, he and my mother and I sat and watched men walk on the moon on television.
Mm,
That happened in 59 years.
wow.
Given the computing capabilities we have now and the data that we have right now, because these are all
That's
sorted
right.
problems. I'm sure you've seen the movie Hidden Figures, where these brilliant women help to do the math to make the movie.
That's
Well,
right.
let's say instead of to augment the brilliance of those women that were the subject of the movie, we now have problem-solving tools that are staggeringly better and
That's right.
advanced.
I
And
mean,
so,
the computing power is in our cell phones, right?
yes, I
That
just
brought us
basically
to the
believe
moon.
that this is going to be applied to figuring out the right secret to prolonging someone's liver regeneration capabilities. I
It's
believe
going
it.
to be great. So I definitely believe now is the best time to be innovating. And so, last question is, if you could have any superpower, what would it be?
To be a great parent.
Oh, I love that.
Because I believe that, and it's not a superpower, it's something you work on every day. I think the
Mm.
strongest institution in human history is the family. And I don't mean Ozzie and Harriet, mom and dad, two biological kids. I mean people who love each other, who are bound by
Mm.
love, not by geography or biology or ethnicity, but people who love each other and are
Yes,
willing to lay down their lives for each other. That's what a family means to me. And I think that generally speaking, when someone grows up in that kind of environment, he or she has a really good life. When they don't, they struggle.
I
And so
love that.
my contribution to this, I hope, can be in my own life with the people I love that I can do the very best I can for them.
I wrote a book in my book, Digital MD. The focus for the first forward is just to thank my family, those that we choose, and those that we are born into. Because
Amen.
I think it's true
Love
for,
is love is not about biology.
yeah, exactly. Well, it's been an absolute pleasure discussing healthcare landscape with you. Your insights were very helpful. And for listeners, more on Rob's work, connect directly. You can check him out on LinkedIn. We'll link that in the show notes. And we hope today's conversation has sparked your curiosity and inspired you to explore further. So thank you again for joining us. Until next time, keep on innovating. Thank you, Rob.
Thank you.
Did you know that improving preventive care can significantly impact your health plan star ratings? Everly Health Solutions is the leader in at-home testing for health plans. Their convenient, member-centric approach has helped plans achieve industry-leading results. In just 1 year, Everly Health Solutions helped a multi-state Medicare group improve 15 of their plans by at least 1 star. That's a win for members, providers, and the plans themselves. Learn how Everly Health Solutions can elevate your health plan at everlyhealthsolutions.com.